Hello and welcome to the tutorial video for the Collaborative Trauma-Informed Care tool. This video is part of the Collaborative Teams Toolkit for Trauma-Informed Care, which enables teams to develop and implement trauma-responsive policies, practices, and services throughout their family-serving agencies. This toolkit is comprised of three parts: the Trauma-Informed Care tip sheet, the Trauma-Informed Care tutorial video, and the Collaborative Trauma-Informed Care tool, or C-TIC. Part 1, the Trauma-Informed Care tip sheet, offers an overview of trauma-informed care, the differing levels and types of trauma, trauma's connection to substance use and mental health, and strategies teams can use when responding to various situations, including secondary traumatic stress affecting professionals in the workforce. It is highly recommended that teams review the tip sheet before using the C-TIC tool itself. The Trauma-Informed Care tutorial video guides teams through the C-TIC's major elements, demonstrates how to enter information, and examines the best ways teams may use the tool to plan the implementation of their trauma-informed approach. The third part of this toolkit, the Collaborative Trauma-Informed Care tool, or C-TIC, is a tool that supports teams as they develop and implement trauma-responsive policies and practices, as well as trauma-specific services throughout their service delivery systems. The C-TIC strives to engage persons with lived expertise, along with local community members, in the planning and implementation of approaches to intergenerational and historical trauma. The tool also examines how trauma affects children, parents, and family members affected by parental substance use, as well as the secondary traumatic stress that professionals experience when serving these families. Now, let's walk through the tool. The Collaborative Trauma-Informed Care tool is organized across 5 domains. 1. Implementation of trauma-informed policies and procedures. 2. Building a trauma-informed workforce. 3. Supporting relationships with families. 4. Fostering trauma-informed services. 5. Creating safe and respectful service environments. As you can see, each domain has its own specific table consisting of multiple components that comprise a trauma-informed response. It's critical for collaborative teams to engage people with lived expertise and local community members in the development of activities across all 5 domains. Collaborative teams can use this tool to review each of the components and determine their team's current level of readiness to implement each one. Both groups provide valuable insight into each team's level of readiness to accomplish this. The C-TIC tool details 5 distinct levels of readiness and a descriptor for each one. These readiness levels are based on Prochaska and De Clemente's trans-theoretical model of change. For the purposes of the C-TIC, the levels of readiness are as follows. First is the pre-contemplation level. Here, the component has not yet been identified as a need. The contemplation level means the component has been identified. During the preparation level, initial conversations on how to implement that component have begun. Next, at the action level, steps are actively taken to implement the component. Finally, the maintenance level signifies policy or practice adoption and sustainment. Once teams determine their level of readiness, they may place a brief statement explaining current actions within the corresponding field of the table provided. For example, in Table 1, implementation of trauma-informed policies and procedures, one of the components to this domain is develop memoranda of understanding and data sharing agreements across systems to help with information sharing priorities related to trauma-informed care. If a collaborative team has begun developing data sharing agreements, but they are not finalized, the team in the action field could note initial drafts of data sharing agreements between partner agencies developed, progressing through approval process. Here's another example. In Table 2, building a trauma-informed workforce, one of the components is conduct an inventory of existing trauma training available to staff across systems. If the collaborative team understands the need to conduct the inventory but no action has been taken, the team in the preparation field could note identifying key partners to participate in inventory. As teams walk through each component, the tool offers a comprehensive view of their current level of readiness to implement a collaborative, trauma-informed approach. Along with determining their collaborative's level of readiness, a team can also prioritize implementation of the various components. The priority for action field enables teams to indicate if a component is an immediate action item or if they desire to implement it within the next 2, 3, or 5 years. For example, given the components discussed above, if the team wants to complete this component in the next year, they would add immediate to the priority for action field. Likewise, if this component is just getting started, the team might put 2 years in the priority for action field. Identifying priority levels allows the team to focus their resources and efforts towards their most critical components while still holding space for the others. The perspectives and input of those with lived expertise and local community members should help determine each component's priority level. As teams walk through this process for each of the components, they'll have a holistic view of their current level of readiness to implement trauma-responsive policies and practices, as well as trauma-specific services throughout their service delivery systems. It's critical for collaborative teams to engage persons with lived expertise and local community members. That way, teams can meaningfully identify trauma-informed components related to each of the 5 domains, understand their current level of readiness, designate their priority of action, and identify resources to allocate to the implementation of that component. Understanding the current level of readiness provides teams with vital information to develop an action-oriented plan, one that improves their response to the effects of trauma for the children, parents, and family members they serve. The effectiveness of the trauma-informed practices in the C-TIC depend on 1. Recognizing the extent, reach, and effect of trauma, and 2. Understanding that attending to all 3 requires a coordinated cross-system approach. By understanding the effects of trauma, professionals can improve outcomes for children, parents, and family members affected by SUD and co-occurring mental health challenges. Trauma-informed collaborative teams realize the effects of trauma, recognize its signs and symptoms, integrate knowledge about trauma into policies, procedures, and practice, and avoid re-traumatization. Simply put, these approaches strengthen families by keeping them engaged in services, allowing all involved to develop resilience, heal, and improve individual health, family functioning, and overall well-being. We hope this tool, as part of the Collaborative Teams Toolkit for Trauma-Informed Care, enables teams to implement trauma-informed practices that improve outcomes for children, parents, and family members affected by substance use and co-occurring mental health challenges. For more information on this and other topics, please visit the National Center's website at ncsacw.acf.hhs.gov.